Hello, Johnny Rotten here with an article. So, I've been talking about lately some of the upcoming syndromes or disabilities you're going to start to see due to some of the events that have taken place during our sci-fi movie we're all living in. This article, I put the link in if you want to go look it up yourself, but this comes from a doctor's website. He specializes or works with a lot of patients with this type of disorder. What is POTS? Your guide to symptoms, causes, and treatments. And so, what we know about POTS, what we don't, and what you can do about it. So, it's got some key takeaways. So, if you've been diagnosed with POTS, postural orthostatic tachycardia syndrome, there's a decent chance you might have more questions than answers. So, what is POTS and how common is it? What do doctors and scientists really know about it? What caused it? Is it curable? You may also be seeing this post because you're searching for answers to your mysterious symptoms, such as shortness of breath, heart palpitations, muscle weakness, and or lightheadedness every single time you stand up. And you might have some brain fog. Here is your action plan. Although awareness is rising, there is still a lot of confusion surrounding POTS in the medical community, and there are many unknowns. So this is one of those disabilities that is still not heard of from most doctors. They've still never even heard of it. And it is about to become a major problem for society. So it's going to be, everyone will have heard of it soon. But we are starting to learn more about it. And there is no cure for it. They have some treatments, but there is no medicine that can cure you. And so that's why they need you to come to the doctor and share your POTS stories with them so that they can take apart your genome, find out where it lies, ask you a bunch of questions about your life, and they'll find it. Let's dive into what we know. What is it? Postural orthostatic tachycardia syndrome, or POTS, is sometimes referred to as or abbreviated to. It's the same thing as broadly defined as a chronic and complex disorder of the autonomic nervous system, or the ANS, that affects multiple organ systems. Put in more plain language, it's a syndrome that can negatively impact the proper functioning of the systems of your body that occur automatically, such as your circulation, your breathing, your heartbeat, your lung functions, things you don't consciously decide to do. That's still pretty vague, so let's break it down. To help get a better grip on a POTS diagnosis or potential diagnosis, if you suspect that you might be dealing with POTS, it's helpful to first understand what a syndrome is generally, which is different than a disease or an illness when it comes to how medical professionals, like cardiologists in the case of POTS, define things. So a syndrome is a collection of symptoms with no known direct underlying cause. Sometimes there's a vast array of possible symptoms, and you only need to display a handful in order to be diagnosed. Sometimes there are one or two super common symptoms that nearly every patient has, but the rest are kind of a grab bag from person to person. For example, if there are 10 possible symptoms of a particular syndrome, you might need to have at least 5 in order for a doctor to diagnose the syndrome. Symptoms and diagnostic criteria for POTS. POTS can be a challenging diagnosis because of the wide range of organs it has the potential to affect, but is primarily characterized by symptoms that worsen when standing and significant elevations in heart rate. And it is a test you can do at home. So it's a free test if you have one of those little things they stick on your finger, or you can go pick one up, I think, at any of the drugstores for maybe $10 or under. I don't believe that they're very expensive. You can also do it with blood pressure, but you kind of need to be able to stand up a little, and sometimes blood pressure cuffs, don't always work properly. So it just depends on what you have. But you can go and get this test done for free. That's what I'm trying to say, really. You can get a piece of paper and put your finger on your pulse and go from there. So it is difficult to diagnose, but it is easy to at least check to see if you suspect something's going on and give your doctor the first step. Up to 1% of the US population is suspected to have POTS, and though it is hard to determine due to challenges surrounding diagnostics, younger women, 12 to 50 years old, are the most commonly affected by POTS and typically start experiencing symptoms early on in adolescence, around age 14. Come on, right? Meaning of life. The National Institute of Health, or the NIH, states that women are most often early in their careers or in their education when they become affected, and the condition can have a debilitating effect on their lives. And I know it says US, but you can also find this in Europe. So if you're one of my friends over there, there is the Ehlers-Danlos Foundation is in the UK. So you can be very close by and find lots of other friends that have the same type of issues you do, such as POTS or mast cell activation syndrome or Ehlers-Danlos or a myriad of other connective tissue disorders. In order to be diagnosed with POTS, there are two general criteria a person must meet. One, they have to have orthostatic intolerance, symptoms that worsen when moving from a lying or seated to a standing position, and that improve after returning back to the lying position. And you need to have tachycardia, a heart rate that increases by 30 beats per minute or is 120 beats per minute that occur within 10 minutes after moving from a lying or seating to a standing position. The heart rate increases 40 beats per minute in adolescence. So basically, if you're standing and 10 minutes later, your heartbeat is still at 120 or above, and you have a difference of 30 heartbeats from a sitting position, the odds are, if you manage to make it 10 minutes, because a lot of us just go bloop and pass out, these two symptoms can't occur in the presence of hypotension, so low blood pressure, or other coexisting conditions for a POTS diagnosis. So there's just a little bit of a thing there, but your doctor would definitely be able to help you. And the duration, well, if he bothers to listen to you tell him what you have. And the duration of the symptoms must be equal to or longer than 3 months. And here are some additional exclusions. In other words, if it occurs without significant hypotension, the above criteria are met without a 20 mmHg decrease in symbolic blood pressure, which would otherwise be diagnosed as orthostatic hypertension. So it would have a different diagnosis. Other exclusions, no other coexisting conditions or medications that could explain that. These could include like deconditioning, a complex process of physiological change during a period of inactivity, bed rest, or sedentary lifestyle that may result in the mental and physical functional losses. In other words, you're deconditioned. You've been very slothy. And so, of course, your body's going to have this reaction when you stand up but you would lose it. It would go away. If you have an infection, that can also cause you to be dizzy and lightheaded. If you have a fever, if you have hypothyroidism, I'm not exactly how to say this word, but it's a small vascular tumor of the adrenal medulla, causing irregular secretions of I can't say any of those words either, leading to an attack of the raised blood pressure, palpitations, and headaches. So it's a different thing. If you have anemia, that can also make you dizzy, dehydration, anxiety disorders, which anxiety disorders are really cause and effect. So if you have one of these, your anxiety is high. So they could be mixed together. And if you use any kind of heart medication. So these are just the exclusions when you might have a rapid or high heart rate after standing. Please note that this means that POTS is a diagnosis of exclusion, meaning that all other causes for these symptoms have to be ruled out before giving you the diagnosis. Orthostatic, so they're going to use you as a guinea pig and check all these other things before they conclude that you have POTS. So some of the symptoms for POTS, Diagnosis may include lightheadedness. 90% of people with it have lightheadedness. I'm assuming that's what our percentages are. I'm not sure, but it says lightheadedness, fainting or near fainting, palpitations, a racing heart, shortness of breath, chest pain, tremors, blurry vision, and sweating. Other symptoms of POTS that can be commonly present, not related to the body position, and thus not used diagnostically, will include 90% of the patients have brain fog or cognitive issues. Myself, persistent nausea, headaches, chronic fatigue. 80% of the patients have abdominal pain, muscle pain and weakness, poor circulation. In other words, have very cold hands and feet. 70% of the patients have abdominal bloating, constipation, paratheresis, a tingling in the hand, and neuropathy. In other common findings, diarrhea, sleep disturbances, difficulty exercising, and anxiety. These can also be added problems. Findings in the presence of suspected mast cell disorders. In other words, these two are like a triad. They're in the horrible three. You're going to get flushing, hives, excessive urination, GI symptoms such as mentioned above. This seems like a lot, but that's because it is a lot. And POTS is a multifaceted and somewhat confusing syndrome because there is no single known underlying cause or even an agreed upon set of factors. It is an elusive condition that has made it difficult to recognize, understand, and treat. Until now, because that's what we just got. Long COVID patients suffering after the loosey-goosey and are vaccine injured are coming down with POTS and coming down with mast cell activation syndrome. And what does that mean? I smell money. That means that I'm going to have a whole bunch of people willing to try every one of my ills, pills, and thrills. And that is money. The loosey-goosey, the flooby-dooby was here to make you sick for things that they don't recognize, can't understand, and have no treatment. It's an elusive condition like a virus. It pops out every now and then, and it is in fact linked with your viruses and your DNA. And you can go and Google that. You do not have to take my word for it. It's there. I share a lot of the papers on this channel. So if you're following along and if you just now found me, well, go back and look at some of the other things that we share here. Though POTS is a medically confirmed diagnosis, it has been historically debated as a valid diagnosis in the medical community, which has led to significant barriers to treatment. Ooh, I also want to say too, if you have children that were vaccinated with the HPV vaccine, they might very well be experiencing POTS as also. So as a side effect of some of the toxins. If you have been in an area that has recently had a train derailment, you are at risk for POTS and mast cell activation syndrome. If you've been anywhere where they're burning things or blowing things up or they're spraying your skies, you are at risk. I feel like Jeff Foxworthy now. Maybe I'll go on the road. The NIH states that the misdiagnosis of POTS is common. Some sources say that 75% of us are misdiagnosed despite the clear clinical definition. And many medical professionals are unfamiliar with the diagnosis and treatment options for this condition. The backwardness of the way medical insurance works in the United States notwithstanding, when even the medical community can't agree on certain aspects of this disease or are unfamiliar, proper treatment can be hard to nail down and get covered by your insurance. So more money to be made, insurance companies. Who created insurance companies? Oh, right. The Gardenburgers, or whoever they were, the Gardenbergs. the bird gardeners, the Freemasons. That being said, there are diagnostic codes for POTS as of October 1st, 2022. Now go and stop for a minute. And let's think about the date on that. October 1st, 2022. How far were we in with long COVID in 2022? Which should lend credibility to the diagnoses and the patients dealing with the wide array of symptoms. Research on POTS is severely lacking, and there has been no investigation into its presentation as we age or its long-term effects on the body. So don't forget to sign up for your trials. We are looking for you. We need you. Do you have POTS? We need you. The hope is giving POTS a specific code to create a push for more national research of this condition, educate providers on POTS, and shunt more resources into POTS treatments. Pharmaceuticals, are you hearing the call? They've got a call. They're on it. Diagnostic workups. While the criteria for diagnosis of POTS is clear and standardized, the diagnostic workup and physical exam may vary from the cardiologist to the neurologist assessing you. Heart rate changes are measured between sitting and standing, either manually or with a pulsometer. That's the little thing you can buy. It's called a pulsometer. And you put it on your finger. Blood pressure is also monitored manually to ensure that there's no significant decrease in the first 3 to 10 minutes of standing. And though less common, the quote gold standard for evaluating POTS is through a tilt table test. And in this test, the following steps take place. The patient is strapped to a table where they lie face up for at least 5 minutes, but preferably from 20 to 45 minutes. Nitroglycerine is given orally. The table is tilted to an upright position at about a 70-degree angle. The patient is monitored for syncope or pseudosyncope with head drop, eyes unwillingly closed. If present, these findings strongly indicate a POTS diagnosis. The test ended upon syncopal, they faint after 15 minutes. I was very lucky to have doctors that did not do this test and saw it as a torture device, which it was. And so you do not have to cause the person to pass out. The biggest challenges we all know doctors are sadists. The biggest challenges with diagnosing POTS are the lack of critical exposure many medical professionals have to it and the overlapping symptoms. Other more common conditions. So what causes it? There are no universally agreed upon risk factors or causes for POTS, and most experts in cardiology and neurology agree that it's a multifactorial with high variability between patients, and the more specific subtype of POTS, which are also broadly defined and poorly understood, further muddle the research for the root cause. A National Health Institute meeting of experts in 2019 determined that while POTS often occurs after a stressor to the immune system, do you hear what I am saying? The underlying pathology is complex and likely derived from more than one factor. A viral illness is thought to be one of the more common of these initial stressors and is self-reported in 20 to 50% of the cases. Other common stressors include upper respiratory infection, a GI infection, some type of physical trauma, either a head injury or concussion. And initial menses, that's your hormonal fluctuations. So adolescent girls are common too. And we know this from our antiquity because we had devices and all kinds of things and they showed often women fainting. They told us it was from their dresses, but they also would mention she's on her menses. It's her ladies' days. That's why she's fainting. Fainting was also a sign of pregnancy. Pregnancy, there it is. Surgery. Additionally, a genetic, and this is where we are getting into the money game, and longevity research, epigenetics. Do you have a genetic predisposition or presence of a coexisting autoimmunity and or connective tissue disorder such as Ehlers-Danlos syndrome? It's thought to have played a significant role in making a person more susceptible to POTS. Now, something interesting about this one particular syndrome in general that I'm going to say, because it says that it's considered a rare disease. However, just a second. However, maybe not so much. Okay, it's a connective tissue disorder. And in this particular disorder and many other genetic disorders, it's a 50-50 shot every kid you have. It's a 50-50 shot, which means that there could be a lot of people that have connective tissue or other pre-existing or coexisting autoimmunity or connective tissue disorder that don't know they have it, might never know they have it unless some type of triggering event takes place, such as a trauma to the body and or the mind. So that includes contaminations, forever chemicals, medications, sugars, sawdust, but I don't know, whatever they're putting in your food that you're not supposed to eat. Silicone. The symptoms can come on rapidly or progressively worsen over time, further adding to the complexity and variable presentation of POTS. While recovery is possible, most patients have chronic symptoms that can go through periodic worsenings and or flares. Overall, POTS is characterized by several broad mechanisms that include the nervous system deregulation or the autonomic system, the immune dysfunction, antibodies towards the blood vessels and nervous system, abnormalities in the renin-angiotensin system, or the RAAS, which controls your blood volume, venous pooling, and that's when your blood doesn't flow towards your heart properly in your veins due to valve issues, and it can actually flow backwards or pool. Cardiovascular. So this makes me think of a few people that flew planes. Cardiovascular deconditioning, decreased cerebral spinal fluid or CSF, altered cerebral blood flow, and cranial hypertension. That's a negative pressure in the brain cavity. Disrupted brain barrier, blood-brain barrier, similar to a leaky gut. And man, we did learn a lot about the blood-brain barrier. Never even heard of it until most people. Neuroinflammation. And there are 3 subtypes of POTS, which include hypovolemic, that's low blood volume, a hydrogen, I don't know how to say that. Another one is called that increases your sympathetic activity and elevated levels of some other things I can't say, your ephramine and your adrenaline and your norepinephrine. Neuropathic, the damage to the smaller nerves that affects the ANS and the blood vessel flow. Many patients are not further classified into one of these other subtypes after receiving the POTS diagnosis. There is a significant overlap in presentation across the 3 types, with no treatments that are specific to an individual type. In most cases, these categories do not shed further light on the underlying cause of POTS in a particular patient. What are your treatment options? Because there's still so much to learn as to the root cause of POTS, it can be difficult to come up with a treatment plan that actually addresses the underlying issue. For this reason, the conventional approach to treatment tends to focus on managing symptoms. The functional health approach is not only to address symptoms, but also to promote nervous system regulations and regular exercise. So if we can't cure it, the only way to cure it is designer babies. They take it out. The functional health approach to treating POTS. The functional approach to treating POTS is a 3-fold: calming the sympathetic nervous system. In other words, don't put yourself in stressful situations. Remain calm and happy. Exercising to increase your blood flow and your blood volume, and eating a low inflammation, high salt diet. The problem with exercising is that when you get dizzy upon raising your heart rate, exercising becomes impossible. So that one right there, this middle one, it only works on certain people. Most people are exercise intolerant. So you're left with 2. Eat lots of salt unless it's disgusting and you don't like it, like myself. But salt and staying calm. Research in the area of POTS treatments beyond just symptom management is shockingly lacking, and more work needs to be done to better understand treatment options across the categories. So money is made here. Hello, investors. Research for a newly rediscovered illness. Your research dollars and donations are wanted. And of course, you can donate to the POTS Foundation and the Ehlers-Danlos Foundation and every other foundation. So calming the sympathetic nervous system, however, based on limited evidence, so we need more treatments that work to balance the autonomic nervous system by decreasing stress and increasing vagal tone are great starting points. How can you stay stress-free when everything around you is telling you the world is ending? This can be tracked through heart rate variability. This means things like a biofeedback, cognitive behavioral therapy, exercise, physical therapy, occupational therapy, guided meditation, yoga, deep brain stimulation, and transdermal vagal stimulation. And now that is money. Money, 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 money. Physical therapy, opening a physical therapy clinic would be a great investment. Becoming a meditation or yoga teacher, right? How about those sounds and headphones and stuff that gives you the visuals and the sounds, the deep brain stimulation? Money, and research is just still pending here. Other practices that support heart rate variability and vagal tone include singing, music therapy, chanting, mindful-based stress reduction, and emotional freedom technique. What the hell is that? I'm using that technique right now. These interventions and practices help reduce sympathetic nervous system activity, which appears to be central in treating POTS and alleviating symptoms. You can exercise. It also seems to be mostly agreed upon that exercise, both weight-bearing and aerobic, can be helpful intervention in the treatment of POTS. That's because exercise increases blood volume, promotes healthy circulation, and boosts your mood and mental well-being and quality of life. Exercise is a treatment included in both functional and conventional approaches. And since they can't exercise like the normal people, opening a clinic with a pool, indoor pool where it's temperature moderated, because remember, they have dysautonomia and often are heat and cold intolerant, temperature intolerant. But the water is a great idea for these people. It keeps them from fainting. And so pool exercise would be a great investment. Depending on the person's current level of physical fitness, they may need to start with seated or horizontal exercise to prevent heart rate increases. You can row, you can swim, you can do a bike, Pilates, you can plank. That's my favorite exercise, planking. You can try resistance band and, of course, the physio ball. And if these symptoms are severe, they will likely benefit from observation during exercise, like with a physical therapist, to prevent syncope and injuries. As physical fitness improves, the intensity, duration, and frequency of exercise can all be increased to functional capacity, the body's physical tolerance, which can also be more easily achieved with professional guidance. And then it goes on to talk about some things about your diet and other things. And that's just going to tell me more, as every holistic functional approach to medicine and diet. Money, money, money. The green movement is coming in here. The conventional approach. Look at that. Some salt pills, keeping yourself hydrated, sleep with your head elevated, etc., etc. So here are some of the medicines currently used if you want to invest your money in these types of things. We've got beta blockers. Those are going to become very popular here shortly. We got some fluorocortisone. That's going to expand their blood volume. That's also going to be one that we should start building some factories for. The lower your sympathetic overactivity alpha agnatists like chlorodyne. I don't know what these are, except what it's telling me, so I can't pronounce them. Stimulants, antidepressants, is that benzos, benzodiazepines. I think that's how that's said. I have heard people say that word. And of course, pain medications have indicated, such as in the Ehlers-Danlos. It is worth flagging that benzos are highly habit forming, and taking them on a regular basis can lead to addiction and drug dependence. Try to avoid taking them. And of course, just educate yourself, because knowledge is power. So that is what is, coming in the future. I am Joni Rotten, predicting the future. Not because I saw it in a dream, but because I read it in a paper.